Currently, our nutrition program, that is the integrated management of acute malnutrition, records around 4,000 children who are severely malnourished who are being currently managed at the program, and 17,000 children who are currently enrolled to moderate malnutrition, and 7,000 pregnant and breastfeeding women who are also enrolled into moderate malnutrition program.
Kenya, just like other countries in the Horn of Africa, continues to be affected by erratic weather patterns that are attributable to the changing climatic conditions. And we're seeing across the years how countries, especially Kenya, continue to move from one climate-induced shock to the other. If it's not drought, then it's flooding, and then it goes back to drought again and flooding. And this has become almost the norm, because every successive years we see these spells of drought affecting communities, and therefore making the communities more vulnerable and reducing even the abilities of the communities to become resilient. Because if a community moves from one incident of drought, there's hardly enough time to recover, and then another incident of drought comes, then it ensures that these communities perpetually remain in a state of vulnerability as a result of such shocks. And over the years that we have been tracking this progress, we have seen a stagnation, meaning that the hunger is not reducing. So the food security indicators have remained unacceptable for over a long period of time.
As we have received an update from the short range assessment, where about 95,000 children are estimated to supposed to receive treatment of acute malnutrition. So, coupled with the current challenges on funding and the drought, we have the drought and support, partner support going up. What this tells us is that the numbers are going to go high. The cases have reported about 17,000 who are moderate. They will start to severe cases in the red. That is, so that number is going to rise from more than 4,000. So that is the situation where we are currently.
This current project targets children under the age of 5 years, as well as pregnant and breastfeeding women, who are the most susceptible to the effects of drought. Because as per the SMART survey results of 2024, 26% of children are suffering from acute malnutrition. Concern works with the county government to build the capacity of healthcare workers so that they have the technical skills to diagnose and treat acute malnutrition, which is a major problem in Turkana County.
So the purpose of the visit is for us as the county government to provide information on the current nutrition situation here. We are currently on a drought situation that has affected most of the households here. We were supported by Concern to do nutrition surveillance. That is now conducting mass screening in the county. So Concern supported the entire Turkana East, and then other partners, which I can say IRC, AMREF, and IAM supported a number of sub-counties to map the hotspot areas depending on the representation, the data that this mass screening presented to us.
The objective of this trip is to interact with community members, to have a feel of how they are coping with the current drought situation, and to understand what can be done from the community perspective, and also what kind of support they would want from partners and even the government to build their resilience in coping with the current drought situation.
This is one of the outreach Our outreach coverage is about 24%. We had a total of 498 outreaches, but currently we are standing at 24% coverage. So we not even half. So outreach enable us to reach more areas that this population was not accessing at their facilities. So we conducted the mass screening and we highlighted some of the hotspot areas. Those hotspot areas are the ones that the partners and the county government will direct their resources. So in Turkana North we have about 74% areas that were not been exhaustively been outreach conducted. Mass screening has been conducted. We have a gap of that in north, and then to west we also have a gap about 223 additional hotspots that we need to conduct the mass screening.
Through funding from the US government, Concern has been supporting communities in Turkana County to mitigate the effects of the prevailing drought condition. In collaboration with the county government, Concern is working in 4 sectors. Under Sector 1, we work in agriculture. Under Sector 3, we are working in the health and in the nutrition sector, where we are supporting households to access health and nutrition services. Sector 2, we are working on food assistance. Also, we work under the wash sector, that is water, sanitation, and hygiene. And through this, we ensure that households are able to access clean water. And we've done this through rehabilitation of boreholes.
Sapcone is working as an implementing partner together with Lokado. For Sapcone, we are implementing this project in 2 sub-counties, that is Turkana Central and Loima. In Turkana Central, we have got 10 project sites. Loima, implementing the project in 10 sites because the total sites are 23. Sapcone supports 804 households in all these 23 sites, and the participants were identified from these sites through malnutrition criteria, which was the primary criteria for targeting registration of these participants. And of course, for all the cases, all the severely acute malnourished children, we targeted all of them in every facility. And of course, the rest, the children who are moderately acute malnourished and pregnant and lactating women in the malnutrition program, we targeted 50% in each of the facilities. The project provides these participants with cash transfers, 3 cycles. Each transfer is paid 5,000 and of course 5,021 shillings, inclusive of withdrawal charges. Participants solely use the money to be able to procure food. We are getting very positive feedback from the participants that the intervention has actually helped so much. The health of children has greatly improved, and of course, they're saying the intervention was timely.
Karena kalapan tengah rupiah mana, bahkan memang lukinya kan. Apa tengah rupiah mana tengah raksasa, kotor, abu umir, abu kaku umir. Anak yang tengah rupiah mana, apa tengah raksasa, atau jela aku mau, ayah, itu karena sawah. Alakara, buatin itu tengah ulu, alakar kena, abala, aku juga ngarak kecil, ada ya kasih. Kotor ya ngarakin kalau ngarakin apa? Itu karena sawah atau jela kemudian atau jela kano atau jela segari atau jela boka atau jela mcele berdang ala karena ngakurang na saya itu karena kamu nanya yang dolar itu naka itu karena kamu butuh rupiah nanya itu karena saya dulu lalu kacang itu bicara nih kamu bicara buat itu berdang tadi yang aku ingat diam kotori abu ko kun kotori mani kan na kalau ada una turun bareng boy kin ko na mata nya ngato de sini amta na ngarai ko itu bun boy kin na ita tani jadi taro ban karya kan abu sa ko yu tahu ngai caklatan to kan na ngarai ko jan kan kan na jadi lo bala boja nardo nara ngai to sih Dari koko sih, kota reci dah mulu. Ini kau lagi kita koko na, kutuara tako. Abu kau lagi mata kita, kuriai, Kadangnya itu aninya bakati sakona. Ini patang yang ngaragna. Pako ba na wari ngaragna tani. Abala ba jato kana karo na kayo na si. Kan ngaragna di kana karo kami. Ako na kolapan ta rupiah at ngarman. Matandang bata lang nagkakamang daan itu pinula peleng atalan kili ko ba jay ka mo din ito kaya nito nga kanya asa igor molo sapa to rupiah ka pagkagala pa ni iti ora ka ba na ba ko ba ko to nga kanya ni jana era jegi ni ko mo yun yang jual itu ati to belum dia capula ora ka ba na ko ba ani ba na bo pa tanga rupiah ko pagkagala na laban sundia ora ga aku apa kan ko coba nang rupiah na ba Rubo cari ngarban dalar tu, bawa kini gente kayak kini Kakon rubo ni.
Additionally, the community through that support, they have formed a mother-to-mother support group at Naoros, where mothers come together, share knowledge on optimal nutrition practices, and through that, the mothers who are enrolled in that group when they had children who are malnourished, currently they all graduated. The children got cured.
We have 12,844 households, and we have 43 health facilities. 35 of them implement IMAM program, where we offer nutrition services in under 5 children and pregnant and lactating women. The outreaches supported by Concern Worldwide help us to reach the further communities which have more distance from the linked facility.
When we started the program at October, we had an admission of 77 cases for some, and for mom, that is moderate acute malnutrition, we had 345. For pregnant and lactating women, we had 147. The whole 9 villages for Kaeris. So as per now, we have increased numbers of some cases due to program that stopped, that is for moderate acute malnutrition. So the cases are increasing, have gone up to 86 cases currently for the whole catchment population of Kaeris. For moderate acute malnutrition, currently we have a very high defaulter rate.
Our target for now, we're reducing to reduce the severe acute malnutrition to less than 10. Well, since we began the project, we had a severe acute malnutrition of 15 and moderate acute malnutrition of 123. Since moderate acute malnutrition we reduced to 5. And at the end of the March after the program, we are trying our best to see to ensure we've meet our standard or we meet our target.
We are seeing the number of children who are at the risk of facing malnutrition shooting upwards from 15% all the way to between 30 and even 40% in some of the counties. Turkana County is one of those counties.
So we really need support from if there is any way they can support us to increase the number of villages to be, for the cases to come back.
But more importantly is the issue of funding, which in the recent years has not been meeting the needs in as far as addressing food security is concerned. And that's why you see, for example, in Kenya, despite the fact that we have huge needs to address food insecurities, the resources that are available from the government and from development partners do not meet those needs.
Amid the current diminishing funding resources, we want to say that we coming together as a team with our partners and other stakeholders is the best way for us to approach this current situation, so that we, the vulnerable population, the children under 5, pregnant and breastfeeding women, are not affected.
Which means that the government and the development partners need to step in now to prevent the situation from deteriorating.
And that's why we are raising the voice with any channels, any means to seek for support to assist this vulnerable population.